ASH 2015 coverage. Thomas Baldrick, joined now by Dr. Alessandro Vannucci from the University of Florence in Italy. Nice to see you again, sir.
Nice to see you.
Let's talk about the Phase III Persist-1 study. What makes Pacritinib a potentially useful agent in treating myelofibrosis?
Well, Pacritinib is a JAK2 inhibitor with minimal activity against the JAK1, and this makes it different from the approved JAK inhibitor that we have now in clinical practice, that is ruxolitinib. And this drug is a JAK2 inhibitor, and so we have experience from other drugs, similar drugs, that it may be effective in treating patients with myelofibrosis. And the properties that might make Pacritinib slightly different from others is the fact that first, it does not target JAK1. Second, it seems to have less myelosuppressive activity as compared to ruxolitinib, for example.
What was the design and key results of the Persist-1 study?
Persist-1 is a randomized Phase III trial where about 200 patients with primary and secondary myelofibrosis, intermediate and high risk, were randomized to receive Pacritinib versus best available therapy with the possibility of crossover. And the main endpoint of the study were two. One was the primary key endpoint, that was the proportion of patients obtaining a reduction of 35% as compared to baseline in the spleen volume. And this was a positive outcome of the study. And the second main outcome was the proportion of patients showing an improvement in symptoms that was measured as a 50% improvement in the total symptom score, that is a tool for measuring global symptoms in patients with myelofibrosis. And again, this was shown to be positive in Pacritinib as compared to best available therapy. But the most important structure of the trial was that patients with myelofibrosis were allowed to enter independent of the platelet count. They were just stratified having more than 100,000 platelets, 50 to 100, and less than 50,000 platelets, so no restriction for platelet count. And it was shown that the improvement in spleen volume and symptoms were the same independent of the platelet level or the platelet class to which the patient belonged.
How significant are the implications of the results you've gotten?
Well, I think that this confirms, first of all, the impact of targeting JAK2 signaling in treating patients with myelofibrosis. This is a further confirmation that we can target splenomegaly and symptoms. And in addition, it came out from the results of Persist-1 that about 25% of the patients who were transfusion dependent at baseline actually improved and became transfusion independent. So these results and the fact that the drug can be used also in patients with low platelet count, that was a limitation of COMFORT studies, because only patients with more than 100,000 platelets were allowed to enter the COMFORT studies. I think that these are additional values of Pacritinib. Of course, there are other drugs under clinical trial, and also for ruxolitinib there is a trial that is intended to evaluate the efficacy and the safety of the drug also in thrombocytopenic patients. So it's clearly a field in movement, let's say.
What's next with this?
Well, there's another trial that is Persist-2 that is ongoing, and of course the next steps in the general field of myelofibrosis is to move towards a more more activity against the disease, the mechanism that leads to the disease itself, because we know that these drugs are effective for the patients. There are evidences that ruxolitinib prolongs survival according to the analysis of COMFORT studies, but we still lack strong evidence that they are drugs directed against the disease, the basis of the disease, the mechanism of the disease themselves. So this is the challenge for the future.
In the meantime, it's got to feel better to be able to help patients with a better quality of life in dealing with myelofibrosis.
There's no doubt about that, because the introduction first of ruxolitinib and hopefully of novel agents has significantly changed the approach to the treatment, and most of all it has changed the life of many patients with myelofibrosis.
Very good. Thank you, sir. Best of luck.
Thank you.